difference between someone who is moody and someone who has bipolar disorder. There's a difference between someone who gets insecure in a relationship and someone who has attachment disorder. Things are being pathologized to a degree that I believe is unnecessary. Oh, I'm Elise, therapist for a million years, coach for therapists who want to make more money. Just because you can get moody doesn't necessarily mean that you need to be treated for bipolar disorder, unless it is getting in the way of your life or your functioning and it's concerning to you. There seems to be an intolerance of a range of human emotions and a labeling of those typical range of human emotions, because people think that if they don't feel happy and blissful all the time, there's a problem, which usually there isn't. I'm a fan of labels and diagnoses in general when they're not needed. They can be helpful answering questions for someone who's been struggling for a while, like, oh, that makes sense, and in guiding medication. But you don't have to find a name for something. Maybe you just get insecure sometimes in relationships. It can be as simple as that, right? Yeah, that's something you can work on, sure. But you don't have to go finding a name for it and decide that it is because of some trauma in your childhood. Maybe it is, but maybe it isn't. It isn't a foregone conclusion that it is. So you don't have to have a name for everything, right? You can just let it be what it is. And that sometimes is good enough.